McDaniel. I'm Ashley Martin.
And I'm Anthony Limbrick. We're going to talk about hypopituitarism. The pituitary gland does not produce one or more of the hormones it is responsible for, or not enough of the hormone. The pituitary gland is a small gland that is between the hive and the base of the brain. It secretes hormones that control almost every part of the body. The pituitary gland secretes many hormones, including the thyroid stimulating hormone, and this hormone is responsible for stimulating the thyroid gland. The thyroid controls mitochondrial stimulation, how much energy the body uses, and anything from nerve function to heart function. It also produces the follicle stimulating hormone. This controls the release from nerve function to heart function. It also produces the follicle stimulating hormone. This controls the release of estrogen in women and ovulation. It also aids in the release of testosterone and sperm production. This hormone is necessary for fertilizing eggs to mature and the release of the egg during ovulation in women. In men, it is responsible for acting on interstitial cells of the testes to stimulate them to secrete testosterone. Prolactin is a protein necessary for preparing the breast for milk production. The most important hormone secreted by the pituitary gland is the growth hormone. This hormone promotes body growth. When these hormones are limited or absent, there are several side effects and symptoms.
Hypopituitarism is a condition of the pituitary, which is a small gland located at the base of the brain in between the eyes, which is right here. Hypopituitarism and panhypopituitarism can be congenital or acquired. Congenital hypopituitarism is found in children or infants and is usually a result of the stress of labor and delivery that has on an infant's body. Acquired hypopituitarism is caused by things such as a head trauma causing brain injury or a disease that affects the pituitary gland and its hormone secreting ability. There are many other causes of hypopituitarism, such as histiocytosis X, and tumor invasion into surrounding structures and the skill of the neurosurgeon. Another cause that is now being more frequently looked into and recognized is traumatic brain injury. During surgery, oftentimes the pituitary gland is destroyed or damaged, causing one or more of the pituitary hormones to be deficient. Radiotherapy for pituitary adenomas is by far the most common cause of hypopituitarism. Macroadenomas, or greater than 1 centimeter, are associated with one or more trophic hormone deficits in 30% of cases. Direct compression and destruction of the surrounding normal pituitary leads to hyposecretion. Microadenomas, or less than 1 centimeter, rarely affect pituitary function, but prolactin-producing microadenomas can cause suppressed follicle-stimulating hormone, hemochromatosis, tuberculosis, syphilis or meningitis, or radiation, surgery, and withholding of chronic glucocorticoid replacement. Pituitary tumors or adenomas are the most common cause of hypopituitarism in adults. Pituitary adenomas cause blood flow to decrease to the normal tissues, compress the normal tissue, or cause interference with the delivery of hypothalamic hormones. Surgical removal of pituitary tumors can cause damage or complete destruction of the pituitary gland. The remaining viable pituitary function is dependent upon the extent of tumor invasion into surrounding structures and the skill of the neurosurgeon. Another cause that is now being more frequently looked into and recognized is traumatic breast follicle-stimulating hormone and luteinizing hormone secretion. These are just a few of the ways a person could develop hypopituitarism. There are far more. In hypopituitarism, the pituitary gland response is absent, suboptimal, or inappropriate. This means that the hormone-producing pituitary gland either produces few or none of the hormones it is responsible for. The pituitary gland is responsible for producing a number of hormones. Adrenocorticotropic hormone, which is responsible for releasing adrenaline and cortisol, which regulate many aspects of the metabolism, immune function, and blood pressure. It is produced by the pituitary gland. Another hormone produced is the follicle-stimulating hormone, which is responsible for sexual development. Hormone produced is the follicle-stimulating hormone, which is responsible for sexual development. Follicle-stimulating hormone controls estrogen and testosterone levels as well as sperm and egg production. Prolactin is another hormone that affects women in the reproductive area. It is what causes milk production and breast growth for lactation. TSH, the thyroid-stimulating hormone, is controlled by the pituitary gland. The pituitary gland stimulates secretion of the hormone from the thyroid gland. TSH regulates the body's metabolism and is required for growth and brain development. The most important hormone secreted by the pituitary gland is human growth hormone. This controls the growth of bones and tissues of the body. These are just a few of the hormones secreted by the pituitary gland. There are many others that are essential to normal function of the human body.
The lack of secretion of one or more of the hormones produced by the pituitary gland can cause serious problems in one's body. In infants and children, some of the most predominant symptoms include small genital organs, short stature, absent or delayed puberty, and mental development delay. The majority of these symptoms are due to lack of the human growth hormone and the follicle-stimulating hormone. In adults, there were several complaints about more outward problems with hypopituitarism, such as loss of libido, loss of hair, lack of vigor and decreased tolerance of exercising, decreased social functioning and fine facial wrinkles, along with diminished muscle mass and an increase in fat mass. Other signs and symptoms of hypopituitarism are jaundice, a condition characterized by yellowing of the skin, hypoglycemia, low blood sugar, irritability due to diabetes insipidus, increased thirst and urination, fatigue, mental inertia, and facial distortion. Pituitary tumors may be treated with medical therapy, surgery, radiotherapy, or a combination of these modalities. Though often misdiagnosed or undiagnosed and not curable, hypopituitarism is an easily treatable and manageable disease. Hormone replacement therapy is a lifelong process, but is essential to the management of hypopituitarism. Poster board, we have signs and symptoms of hypopituitarism at different ages. In this picture, we have toddlers who it shows how when the human growth hormone is absent, at the same age, one child is shorter and the other one is taller. The shorter child has hypopituitarism and doesn't grow as fast. And here we have an elderly lady who has, as we mentioned before, the facial distortion. That was one of the biggest complaints when it came to adults in hypopituitarism. There's often more graying of the hair. Table on the poster, we listed a few more of the symptoms and the signs of hypopituitarism. We went over it, but in infants, they have smaller genital organs. Jaundice is a condition characterized by yellowing of the skin. Hypoglycemia, irritability due to diabetes insipidus. Diabetes insipidus is a condition in which excessive amounts of urine are passed. That is another one of the symptoms, the increased urine or increased urination. In children that are older, in infants that are born with hypopituitarism, there's very different from children. Children usually have a shorter stature and a slower growth. Their mental development is delayed. Increased thirst and urination from the diabetes insipidus. Fatigue, weight gain that's out of proportion to growth. Absent or delayed puberty. Visual and nervous system problems, decreased visual acuity, abnormalities in peripheral vision, and headaches. In adults, they talked more about the loss of hair, being tired, loss of libido, mental inertia. Sensitivity to cold was one of the biggest ones. and they tend to have a slower, softer, more monotonous tone and speech when they talk. Changes in appearance. Like I said, her face is slightly puffier. The thinning of the eyebrows, the thinning of the hair, discoloration in the skin. Those are all signs and symptoms of pituitarism. Is often misdiagnosed or undiagnosed, and it's not curable. But with hormone replacement therapy and surgery when needed, hypopituitarism can be controlled and managed. Thanks for watching our video.